Welcome to the We Level Up Treatment Center video series. In today's video, we will discuss Wellbutrin and alcohol. What is Wellbutrin? Wellbutrin, also known by its generic name, Bupropion, is a prescription medication used to treat depression and seasonal affective disorder. It is also sometimes used as a smoking cessation aid or to treat attention deficit hyperactivity disorder, ADHD. While it is generally considered safe and effective when used as directed, combining Wellbutrin with alcohol can be dangerous and potentially life-threatening. Despite the potential benefits of Wellbutrin for treating depression and aiding in smoking cessation, mixing Wellbutrin and alcohol can be a recipe for disaster. Combining Wellbutrin and alcohol increases the risk of experiencing dangerous side effects like seizures. Wellbutrin and alcohol use may render the medication less effective altogether. Drinking while taking this drug is far from wise. If you're planning on drinking alcohol while using Wellbutrin, talk to your doctor first to ensure that you are managing any possible risks. Furthermore, if you experience any changes in mood or behavior after drinking while taking Wellbutrin, contact a healthcare professional immediately. Wellbutrin and alcohol. Side effects alcohol and Wellbutrin are central nervous system depressants, slowing down brain function, and can cause drowsiness, dizziness, and impaired judgment. Mixing alcohol and Wellbutrin can be risky, leading to seizures, hallucinations, delusions, paranoia, depression, and suicidal thoughts. Plus, it could affect your tolerance for booze as well. It is important to note that the risk of adverse effects is not limited to those who abuse alcohol or take Wellbutrin in excess. Even moderate alcohol consumption can increase the risk of seizures and other dangerous side effects when combined with Wellbutrin. Patients who are prescribed Wellbutrin should always talk to their doctor before consuming any amount of alcohol. It is also important to note that Wellbutrin can stay in the body for several days after taking it. Patients should avoid alcohol for at least a week after discontinuing the medication. Can you drink alcohol while taking Wellbutrin? When it comes to combining alcohol with Wellbutrin, there are several potential risks and consequences. While it may be tempting to drink alcohol while taking Wellbutrin, doing so can negatively affect physical and mental health. One of the most significant risks of drinking alcohol while taking Wellbutrin is the potential for seizures. Both alcohol and Wellbutrin can lower the seizure threshold, meaning combining the two can significantly increase the risk of experiencing a seizure. This risk is not limited to those who abuse alcohol or take Wellbutrin in excess, and even moderate alcohol consumption can be dangerous when combined with this medication. In addition to the risk of seizures, combining alcohol with Wellbutrin can lead to several other adverse side effects. These can include drowsiness, dizziness, impaired judgment, and increased risk of depression and anxiety. Some people may also experience a Wellbutrin alcohol hangover, including symptoms such as headache, nausea, and fatigue. How long after taking Wellbutrin can I drink? You should generally wait at least 24 hours after taking Wellbutrin, Bupropion, before drinking alcohol. This is because Wellbutrin can increase the effects of alcohol and affect your coordination and judgment, making it unsafe to drink until the drug has had time to leave your system. If you have any concerns about drinking alcohol while taking Wellbutrin, it is best to consult with your healthcare provider. Wellbutrin and alcohol. Death combining. Wellbutrin and alcohol can potentially lead to serious health risks, including the risk of death. While it is rare for someone to die directly from Wellbutrin and alcohol, this combination can exacerbate pre-existing health conditions or lead to accidental injury or overdose. Wellbutrin alcohol death. It is well established that combining Wellbutrin and alcohol can lead to serious side effects that can be life-threatening, such as seizures or an increased risk of suicide attempts. The risk of death from combining Wellbutrin and alcohol is higher for certain individuals, including those with a history of seizures, liver disease, or kidney disease. Additionally, consuming high amounts of alcohol or taking more than the recommended dose of Wellbutrin can also increase the risk of death. The combination of Wellbutrin and alcohol can also increase the risk of suicidal thoughts and actions, particularly in those with a history of depression or other mental health conditions. In some cases, the risk of suicide may be increased when someone is taking Wellbutrin and drinking alcohol. The risk of death from Wellbutrin and alcohol is not limited to intentional overdose or suicide attempts. Even accidentally consuming too much of either substance can lead to serious health complications and potentially fatal consequences. The combination of Wellbutrin and alcohol can be dangerous and potentially deadly. Follow the advice of healthcare professionals and avoid consuming alcohol while taking this medication. If you are struggling with substance abuse or have concerns about the potential risks of combining Wellbutrin and alcohol, seek help from a healthcare professional or addiction specialist. Alcohol addiction. Treatment. People frequently consider 12-step programs or 28-day inpatient rehab when asked how alcoholism is treated, but they might struggle to name other choices. Several therapy options are now accessible due to considerable advancements made in the industry over the previous 60 years. Ultimately, no one answer fits all, and what may be suitable for one person may not be for another. Merely being aware of your possibilities might be a crucial first step. Alcoholism treatment options. Behavioral treatments. With therapy, behavioral treatments try to alter a person's drinking habits. Health professionals direct them, and research demonstrating their potential for good backs them up. Medications. To assist people in cutting back on their drinking and avoid relapsing, three drugs are now approved in the U.S. They can be taken independently or in conjunction with psychotherapy and are prescribed by a primary care physician or another healthcare provider. Mutual support groups, peer support is offered by Alcoholics Anonymous, AKA, and other 12-step programs for those who are giving up or cutting back on drinking. Mutual support groups can provide an invaluable additional layer of support when combined with care provided by medical experts. Researchers find it challenging to evaluate the success rates of mutual support groups run by health professionals and those led by laypeople due to the anonymity of these organizations. Wellbutrin for alcoholism. Treatment. Wellbutrin, Bupropion, is not approved by the FDA for the treatment of alcoholism. However, some studies have suggested that it may help reduce alcohol cravings and improve abstinence rates in people with alcohol use disorder. AUD. Wellbutrin is primarily used as an antidepressant medication, but it works by affecting the levels of neurotransmitters in the brain that are associated with pleasure and reward. This mechanism of action has led researchers to investigate whether Wellbutrin could also be useful in treating addiction. Treating dual diagnosis clients is a critical aspect of our inpatient treatment experience because co-occurring disorders are strongly correlated with instances of substance abuse. Creating a treatment plan that addresses the physical aspects of withdrawal, the psychological connection with drug use, and managing underlying mental health disorders is part of setting clients up for success. At our dual diagnosis treatment center, We Level Up can implement the highest quality of care. Call We Level Up today. That's it for today. Please subscribe and hit the notification bell. Like, share, and comment. We would love your feedback. Have a great day.